is Alberto Salinas. I'm a crisis response clinician with the SMART team, and I've been with the Center for Healthcare Services for slightly over 15 years. SMART is a multidisciplinary team including the Bexar County Sheriff's Department, Acadia Ambulance, STRAC, and the Center for Healthcare Services, and includes 2 licensed master's level mental health professionals, a care manager, a sheriff's deputy, and paramedic. The goal of the program is to provide appropriate de-escalation and triage and reduce the incarceration, emergency, and inpatient services by providing ongoing engagement. The ongoing engagement consists of the crisis clinician following up on a crisis call from the previous day or night, and I follow up to provide services that they may not have been receiving already. I will go either to their home or I will make a phone call to do that follow-up. If they are interested with the service or receiving services for the Center for Healthcare, I will provide the phone numbers of the intake contact. The follow-up team will contact the person the response team made contact with the day or night before and ask if they are currently receiving mental health services, and if not, I would offer CHCS services. The follow-up team will also provide necessary coping skills if needed and provide community resources such as counseling services, drug and alcohol services, and other services as needed. When responding to a crisis call, the Sheriff's Department, the officer will make sure that the scene is safe for the clinicians and the paramedic to approach the residents or that person before we make contact. The overall goal of the SMART team is to provide de-escalation services and to keep a person from calling the crisis line and to prevent them or keep them out of mental health hospitals, and to provide ongoing services from the follow-up team. In doing so, the consumer will benefit from services provided from the follow-up team, such as counseling services, drug and alcohol counseling services, other services that that person or family members may need. The follow-up team will engage with a person who is either has decomped or has demonstrated some type of psychosis, whether that was hearing voices, seeing things that are not there, or a person that has not been taking their medications and are exhibiting behaviors that may require that that person be admitted to a hospital on an emergency detention. The follow-up team will engage that person and provide internal services as far as giving them the intake phone number to schedule an appointment for services, and then the follow-up team will call that person the following day or the day after to make sure they did schedule an appointment for services. The crisis response team will make contact with that person of that 911 call regardless of insurance or not. However, the follow-up team will make contact with that person and advise them or notify them that the center will assist them in providing services if they have private insurance or other insurance such as Medicaid or Medicare. The follow-up team will provide the information to contact the Center for Healthcare Services, and their phone number is area code 210-261-3084. The address is 711 East Josephine Street, San Antonio, Texas 78208.